Gentleman's time has expired. The chair recognizes Mr. Bilirakis for 5 minutes for questions.
Thank you. Thank you, Mr. Chairman. Thank you, Mr. Secretary, for being here. As you know, I've been a long, strong advocate of research funding and federal efforts to advance diagnostics and treatment for individuals with neurological conditions, including Alzheimer's and Parkinson's diseases. We are making a significant amount of progress in Alzheimer's and going through the HHS fiscal year 25 budget and brief document. I was glad to see some of the proposed initiatives. However, I'm disappointed that Parkinson's disease is not mentioned once. For reference, the term equity is listed 77 times in the document, but not one single mention of Parkinson's disease initiatives. As the fastest growing neurological conditions, what is your agency currently doing to address this rising public health need?
Congressman, thank you for the question, and I assure you that like Alzheimer's, Parkinson's, and so many other of these devastating diseases are a focus at NIH and many of our programs within CMS. The difficulty, of course, is that we have to follow, it's very similar to the answer I gave to Congressman Reese. We have standards that we have to follow based on the laws that you have passed. And so for us to, for example, provide more research money or to include a particular therapy or treatment or drug as part of the Medicare program, we have to follow the process and make sure that we check the boxes, because otherwise, you probably saw an article that came out about a week ago of a number of drugs that the FDA approved, said it were safe and effective, but people took them, nothing happened. And so all of a sudden now all those drugs are not working. And so what we have to make sure is that when we say we're going to help, there's really going to be help coming.
You said that nothing happened. Elaborate on that.
So many of the people who reportedly took some of these drugs, and I could try to make sure I get you that article, many of the people who were taking these drugs found that there was no improvement in their health as a result of taking those drugs.
What diseases are we talking about? Neurological diseases, or?
I don't think they were neurological.
Okay, please give me that information.
I will send that to you. It just came out about a week ago.
Okay, thank you. It's been 1,144 days since this administration took away seniors' ability to access innovative medical devices. When the Medicare Coverage for Innovative Technologies rule, MCIT, was repealed, this administration promised patients it would quickly work on an alternative proposal. Every year we ask that question. This year, my colleagues, again, we want to know, what is taking so long, and will you commit to finalizing this new rule by the end of next month, possibly? You know, seniors are waiting on this, and they can't wait any longer. Can you address that, please?
Congressman, rather than try to commit to something like within the next month that I can't guarantee that, how about we do this? Let me follow up with you and tell you what the latest is. We can then share that publicly if you'd like. But I'd rather not try to commit to something that I can't guarantee, but I understand the importance of this.
Yeah, it's very important to our constituents. I'm concerned that the administration is forging ahead on a proposed rule that regulates laboratory-developed tests. And, you know, this is a bipartisan issue.
And academic institutions.
Yeah. We recently held a hearing with stakeholders talking about the rule, where there's unanimous agreement on this, that the rule is misguided. Is your department listening to the patients and provider communities here? Expand on, and answer that question if you can. And will you commit to ensuring that patients won't lose access to these types of tests under a FDA regulatory regime? Can you respond to that, please?
Sure. First, I think everyone recognizes that having good testing practices is critical for Americans to know what's going on, whether it's COVID or whatever else. Secondly, we like to make sure that those are standardized so that one test will work because everyone uses it and it works, and we don't have issues that some tests aren't working, other tests are. We want to make sure that that's a standard process. There should not be exceptions unless they're absolutely necessary. Academic institutions are saying that they should be outside of the scope of that. We're saying there's no reason why, in the process of making sure all tests work well, that we should allow academic institutions to be treated better or differently. And so I would challenge your statement that there is unanimity in agreement that this rule is a bad one. I believe the rule is a result of talking to all stakeholders and trying to make sure that we have a process that fits for everyone. No one is special in this process as a laboratory. You have the same obligations to make sure what you produce works for the American people. We want to make sure whoever you are, and we elevate those academic institutions. I went to a really great one, Stanford University. But that doesn't mean Stanford University is so special that it doesn't have to follow the same rules that other laboratories have to follow.
I know my time has expired. Thank you, appreciate it.
Thank you. The gentleman yields back, and the chair recognizes Ms. Kelly for 5 minutes for questions.
Thank you, Chair Guthrie and Ranking Member Eshoo and Secretary Becerra. Good to see you. As you know, I'm a strong supporter of FDA's efforts to prohibit menthol cigarettes and